Welcome to the Deep Dive. Today we're getting into something really quite heavy. It's a very personal story, very impactful.
Yes, it's an account shared by Indu Oko on her YouTube channel, Spice FM.
Right. And it's about her experience, a truly tragic one, losing her son.
Mm-hmm. And we'll be looking at her perspective on the healthcare she received, the alleged negligence, and, the bigger questions this raises about care and accountability.
Exactly. It's not an easy listen, but it's important. We want to follow the events as she describes them. That feeling she had when her intuition was saying one thing and, well, the medical advice another.
And then her reflections, looking beyond her own experience to the wider system.
Yeah. It's really a chance for us and for you listening to understand the human side, the real impact these healthcare experiences can have.
So Indu Oko starts by painting a picture of hope, really, the anticipation of pregnancy, that initial joy.
What kind of hopeful start you'd expect?
Exactly. But then pretty early on, she describes this feeling like a deep unease.
An intuition.
Yeah, a strong sense that something just wasn't right. And she emphasizes this, even though it was her first pregnancy, that feeling, that instinct.
That's powerful.
Yeah.
So she listened to that feeling.
She did. She sought medical help. She mentions going to what she called a biggest, best hospital. So clearly she was trying to do the right thing, trusting the system.
Cooking her trust there.
But when she got there, the specific doctor she was meant to see, well, they weren't available.
Oh, so right away, a bit of a disconnect.
Seems like it. She was told to wait, that someone else would see her eventually. It kind of sets a tone, perhaps, of not being the top priority.
Right. And what happened when she was finally seen?
Well, this is where it gets really troubling. She kept saying, something is wrong. They did an initial test,
Yeah.
and she makes a point of saying it wasn't a UTI, a urinary tract infection. But after that, the message she got was basically, everything's fine.
Despite her feeling.
Despite her persistent feeling, she recalls being told, no need for us to do a test, you'll be okay.
Wow. Just dismissed like that. When she's saying, you know what something is wrong.
That's how she recounts it. It really highlights that potential clash, doesn't it? Between a patient's lived experience in their own body and maybe a more standardized medical response.
Definitely. So what happened then? She was just sent home.
No, she actually waited. She and her husband waited in the hospital for 6 hours.
6 hours. On a Sunday morning, she said.
That's right. And the truly heartbreaking part is that, unbeknownst to her, she was leaking amniotic fluid the whole time.
Oh, my God. The fluid around the baby.
Yes, a critical situation that apparently went completely undiagnosed during those 6 hours.
And she wouldn't necessarily know, would she, as a non-medical person?
Exactly. She's relying entirely on the hospital staff, the nurses, the doctors, their expertise, their tests. For that to be missed, it really raises questions about the assessment process.
The consequences were just devastating.
Yes. She states it very plainly. Her baby died the next day.
It's just hard to fathom. Going through all that worry, seeking help, waiting, and then that outcome.
And the trauma, sadly, didn't stop there.
What do you mean?
The day after her son died, she says she was prescribed medication. Medication that resulted in what she calls an unintended abortion.
Oh, no.
Her words were she felt she should have had no business taking it on that day. It just speaks to, well, the potential for post-loss care to unfortunately compound the grief, raising questions about the medical decisions made even after the tragedy.
That's incredibly difficult, adding another layer of pain.
Mm-hmm. And she adds this really poignant detail. She mentions her son would have turned 17 on September 1st, 2025.
17. A whole life, a whole future. It really brings home the permanence of the loss.
It does. And this immense personal tragedy becomes a sort of springboard for her to talk about the healthcare system more broadly.
Right, she didn't just leave it at her own story.
No. She starts asking these really fundamental questions, like how many people go through situations whereby we just needed you to pay a little bit more attention?
There's a bit more attention.
We just needed you to do your job. It's a direct challenge, really, about the level of diligence and care patients should be able to expect.
And she talked about the focus, maybe too much focus on tests.
Yeah, she questions that balance.
Yeah.
Are we sometimes just ordering 10 different tests instead of really looking at the person, listening to them, observing?
Like seeing the whole picture, not just the chart.
Kind of. Potentially missing something vital because you're focused only on the data points, maybe?
And she was clear, these aren't just abstract complaints.
Oh, absolutely not. She stresses these are personal stories,
Mhm.
not PR, not attacks. She mentions the huge emotional toll, but also the financial one, how much pain and how many bills I had to pay.
Right, the practical consequences too.
And she mentions another case, Dennis's daughter's experience, suggesting this isn't just a one-off, isolated incident. It points to maybe a larger pattern that needs addressing.
So her message isn't just anger, it's a plea.
Very much so. A plea for improvement. She urges the country, the people, to do better, to care that much more, to hurry that bit more when things are urgent, to inspect that bit more, be more thorough, and crucially, she says, to value life just a bit more than we value money.
That's a powerful statement. Value life more than money.
It really gets to the heart of it, doesn't it? The ethical foundation of healthcare. Is the focus always on the intrinsic value of the person, the patient? Or can other factors like cost sometimes dilute that?
It's a heavy question.
It is. And for her, accountability is key. She talks about believing there are consequences for negligence.
Here and now, or?
Both, it seems, in this life and maybe even beyond. She even suggests that future generations might end up having to suffer and pay for the price and the consequence of failures happening now.
Wow. That's a stark warning about long-term impact.
It really is. And then she shares this final anecdote. It's incredibly harrowing.
Yep.
About another woman's alleged experience. Having to flee a medical facility. The description is just shocking. Bleeding naked with a urinary catheter between my legs, barefoot, and with a dead baby inside my stomach.
That's horrific. Fleeing like that.
Due to alleged medical error and basically being abandoned, according to the story, it's an image of complete dehumanization, a total breakdown of care.
It almost sounds unbelievable, but it connects back to her core point.
It tragically reinforces everything she's been saying about the need for basic empathy, for valuing life, for responsibility.
And she connects that specific, awful image to a more general feeling.
Yes. She says that many Kenyans feel like many times we've been left on the theater to save ourselves naked and the future in our hearts gone.
Left on the theater, that's such a visceral way to put it. Feeling completely exposed, abandoned by the very people meant to help.
Exactly. A profound sense of being failed.
So where does she leave things? What's the call to action?
Ultimately, she wants these terrible experiences, these painful stories, to be solution drivers, to actually lead to change.
Not just dwelling on the pain, but using it.
Yes. She talks about the fundamental need for society to take care of its own people and maybe reclaiming some values that she feels have been lost. It's about fixing the system from the inside out, based on these lived realities.
So wrapping this up, Indu Oko's story on Spice FM is just incredibly powerful. It's a mother's unbearable loss, yes, but it's also framed as an indictment, alleging serious failures in care.
And it serves as this really urgent call for, well, more compassion, more responsibility, and a hard look at how we truly value human life within our healthcare systems.
It's definitely a story that sits heavy. It makes you confront some uncomfortable truths, perhaps, about systems we generally trust.
And it really hammers home how vital it is to listen, to truly listen to patients, to validate what they're experiencing in their own bodies.
Absolutely. And it leaves us, and you listening, with a difficult but important question to think about. Reflecting on Indu Oko's deeply personal account and her call for a more humane and responsible healthcare system, what are the most critical steps that can actually be taken to ensure that individual experiences of loss and alleged negligence become catalysts for meaningful and lasting positive change?
How do we turn this pain into real progress?
Exactly. Something significant to carry with us and reflect on.